So you've been hurt in a workers' compensation accident, hurt at work, and you've been getting your checks and you've been treating with your doctors. Maybe at the beginning of your claim or some point along the way you had a surgery, and for that you received opioid medication to control your pain. You've heard about what's going on in this country, which is right now, which is basically that the CDC, the Centers for Disease Control, has declared a health emergency because we have like 42,000 people a year in this country that are dying from opioid abuse and opioid overdose. And so your reaction is, hey, whatever happens, whether I'm hurting or not hurting, I don't want to have anything to do with being on any kind of pain medicine. And the question is that good for you? And is it good for your workers' compensation case? I'm Joe Miller, workers' compensation attorney in both Virginia and North Carolina, and that's what I want to explore a little bit today with you. I do have clients from time to time who get in that exact situation. The doctor may even offer them, look, I can get you into pain management. I really can't do much else for you. I've already operated on you and done what medical science can do for you, but at this point, it's really just a matter of managing your pain, and you say, well, I don't want to be on pills, so that's the end of that. And what I tell folks is that there are two disadvantages of going that route. Let's look at the first one. The first real disadvantage is if you have uncontrolled pain, you're not going to be able to maintain any decent activity level. So everybody knows that if you want to recover from an injury, you want to be more active. And if you're hurting really badly, if you do anything, if you walk any distance or it hurts to do just about anything, you're not going to be active. So what's going to happen? You're going to gain weight, which is terrible for your health, as we all know. Your blood pressure is going to go up. You might develop diabetes. The good news is that there are many, many medications out there and other options for treating pain that have nothing to do with narcotic pain medication. There are medications such as, you may have heard of it, Neurontin, or otherwise known as gabapentin. There's something called Voltaren, which comes in both a pill form and a gel form. There's a non-steroidal anti-inflammatories, such as meloxicam, otherwise known as Mobic. You also have things like Lyrica, which really are very good for many people at controlling pain, especially you get down to something like Neurontin. I have clients on 2,700 milligrams a day of Neurontin suffering no ill effects, no side effects, and they're controlling their very severe nerve pain very well. And the other thing is these things are non-addictive, non-habit forming, so you don't have to worry about that. So that's the first advantage, more active lifestyle, and it's just better for you health-wise to have less pain and be more active. Second benefit is this, from an attorney's perspective, from a workers' compensation attorney's perspective, when you say you don't want any more treatment as far as pain medication or pain management, and especially if you're a candidate for that, what you've just done is you've really lowered the value of your claim. What else is there for the insurance company to do other than just pay the weekly checks? Maybe they'll get you into another job, maybe they won't, assuming that your functional exam may have come back saying you can't go back to your old job. So if they're not going to get you in another job, then they're just paying you weekly checks. But other than that, there's really no incentive for the insurance company to settle your claim. You've got two things that are going on. You're going to have to see a doctor, usually minimum 4 times a year, to have those prescriptions updated, to be examined. Okay? Usually it's a pain management type of doctor. And number 2, there's the cost of those medicines. Some of the medicines are fairly expensive. I'm going to be able to project that out for the remainder of your life, because if you have an accepted claim, remember that the insurance carrier is obligated to pay those monies, obligated to cover you for the remainder of your life for your medical treatment. So there's a value to that. Whereas if you're not treating at all, you're not going to pain management, you're not taking any pain medication, where's the value in that? Where's the incentive? I have nothing to negotiate. So I hope that has been helpful for you as far as the dual benefits of really being in a pain management program. There is relief available out there for you in the form of these non-narcotic pain medicines. And also many pain management doctors have a number of other things that they can prescribe for you, certain types of physical therapy. There may be acupuncture. There may also be other things such as injections and things like that they can talk to you about. So I hope that information has been helpful for you. If you have any other questions, please don't hesitate to call us. Again, I'm Joe Miller, workers' compensation attorney. Thank you for watching.